ACLS, okay? So, usually this is a 2 to 3 day lecture and workshop. So I'm a certified pediatric BLS and ACLS provider. So you know what's the difference between BLS and ACLS, okay? You know the difference between BLS and ACLS? So BLS, it's just your basic life support. So just compressions and ventilation. But for your ACLS, you already have advanced stuff such as medications, your adenosine epinephrine, defibrillation. Okay, so that's the difference between your BLS and your ACLS. Okay, so this is a 2 to 3 day workshop on training, and we're just going to compress it to around one hour. So we will just be discussing the important things, and we will be focusing on the algorithm. Okay, so I'll give you the algorithm, so you just distribute it, because this will be the one that you will be following during your return demonstration. Okay, the algorithm. So to whom will I send the algorithm? So can he or she will distribute it to your classmates? Okay. That's your name. Alright. Then distribute it to your classmates. Then tell me once everyone has the algorithm already, so that you can follow the discussion. There's so many of you. CPR. Okay? Now what are the components of your high quality CPR? Before we go to the algorithm, have you read? So number one would be the component. Okay. What's the first component of your high quality CPR is you didn't have ACLS, BLS for your internal medicine yet. This is your first ACLS. Ideally, it should be IM who will teach you first. Okay. It should be adults, because the pediatric side is more specific for kids. So the first quality of your high quality, the first component of your high quality CPR would be to push hard. Okay, push hard. So for infants, what's the depth of your compression? The depth would be 1.5 inches or 4 centimeters. Okay, 1.5 inches or 4 centimeters. For children, it should be 2 inches or 5 centimeters. Alright? So how are you going to position your hands? So for infants and newborns, usually you can use the finger method, 2 fingers. So like this. Or you can use the thumb encircling technique. So like this. Okay? But for children, you can use either one hand method, like this. Or for older children, you can use the two hand method already. Right? Nice. This is nice. So again, what is the first component of your high quality CPR? Push hard. Number 2, okay, push fast. Okay. So what is that very famous song in which your CPR would be that you would be playing in your head, so that you will know that you are pushing fast? What's that song? Okay, so anyway, talking about pushing fast, so what's the rate? What's the ideal rate?
100 compression.
Okay, 100 to 120. But you cannot count that while you're doing CPR. So I'm going to teach you. For most doctors, when we do CPR, there's this song that plays in our mind. Okay, so I'm gonna infect it to you. So it's the Staying Alive song by Bee Gees. Right? So it's funny, but it's not funny when you do CPR. Okay? Fast forward. Oh yeah. So, okay? Like that, okay? So that's the rate, okay? So they say that when you follow the rate, when you play the song Staying Alive in your mind when you're doing CPR, you're gonna achieve the rate of 100 to 120. Okay? So from now on, that will be the song that is playing in your mind when you do CPR. Okay? So third quality of a high quality CPR, third component of a high quality CPR, allow complete chest recoil. Alright? Always allow complete chest recoil. What do you mean when you allow complete chest recoil? So allow the chest to recoil, okay? So this is wrong. This is wrong, okay? That's not allowing complete chest recoil. So when you allow complete chest recoil, it's always like that. Alright? Why? Because you're allowing complete filling of your ventricles of blood, right? Because during CPR, it is you who is doing the job for the heart. Okay? So when you do not allow complete chest recoil, so you're not allowing the ventricles to fill, so there will be still little or no blood which will be pumped to the systemic circulation. Okay? Now finally, fourth component of your high quality CPR would be to what do you call this? Minimize interruptions. Alright, minimize interruptions. Because if you allow interruptions, then you cannot save the life of the patient. Alright, so focus your attention now on the algorithm. Single rescuer algorithm. Then after that, we will go to the dual rescuer algorithm. Because there's just a slight difference. Okay, so let's start. So the scenario, there will always be a scenario. So you are walking down the street there outside, then you see a unconscious child. Okay, so what is the first thing in the algorithm? Verify scene safety. Okay, always prioritize yourself first. Okay, because what if like later in the afternoon you are so excited because you just learned your pediatric BLS, then you saw a child in the road lying. And oh my God, I'm going to apply what I have learned this morning. So you rush to the child, and then a car hit you. So you'll be useless. Instead of only the child needing CPR, there will be only two. There will be two of you now. Okay, always verify scene safety. It's the same. It's the same. What do you call this? It's the same idea on airplanes, in which if you have a child with you, then those masks will come off from above. You will apply the mask to you first, right, before applying to the child. So always prioritize yourself first, okay? So check the scene, then, okay, scene is safe, then what's the next?
Check for the response.
Check for consciousness, okay? Because what if you're walking down the street and you see a guy or a teenager lying on the floor, then again, you're so excited to apply your CPR, then you did not check for consciousness, and then you did CPR right away, then that teenager will shout because apparently the teenager is just drunk. Okay? So always check for scene safety. Also, always check for consciousness. And then, what's the next?
Help.
Ask for help, and then activate the emergency response system. Okay, so it should be fast when you do the return demonstration. It should be fast So check the scene is safe. Hey, are you okay? No response. Call for help, and then activate the emergency response system. Okay? Then after that, you should check for pulse and breathing simultaneously. Alright? By the way, you check for consciousness by tapping the patient's shoulder and say, hey, are you okay? Okay? So, hey, are you okay? Hey, are you okay? No response, call for help, activate the emergency response system. Then after that, you check for pulse and breathing simultaneously. So for pulse, where are you going to check for pulse? For children, the carotid. So the thyroid cartilage slide down, then that's your carotid artery. However, for infants and newborn, where are you going to check? No, brachial. Alright, brachial for that baby. Brachial. Alright, so that's how you check for pulse. Simultaneously, you check also for breathing. When you check for breathing, remember three things. Look, listen, and feel. Okay? You look for what? Just right. You listen for what? Sounds. You feel for air. Alright? You do that simultaneously. So how are you going to do that? And by the way, checking for pulse and breathing, you should only do it within 10 seconds. If you do not feel or you're not very sure if there is breathing or pulse, and it's already 10 seconds, then you do CPR right away, okay? Because we're doing this so fast. So you do that simultaneously, so 1, 1,000, 2, 1,003, 1,004, 1,005, okay? No pulse, no breathing, so start CPR. Okay, again. So, check the scene is safe. So, hey, are you okay? Hey, are you okay? No response, call for help, activate emergency response system. 1, 1,002, 1,003, 1,004, 1,005. No pulse, no breathing, so start CPR. 1, 2, okay? So now let's go to chest compressions. Are you following so far? Yes. So we are going down the line, for that one. We are not yet discussing the right and left arrows. If you are looking at your algorithm, okay. So let's now do CPR. So for one-man rescuer, what is the ventilation to compression ratio?
30
is to 30?
compressions, two breaths.
Okay, 2 breaths to 30 compressions, right? So let's start. So we're on the first cycle first. 1, 2, 3, 4, 5, 6. Then staying alive. And then 28, 29, 30. So you give rescue breaths. Now, please don't be confused about the rescue breaths. Before the pandemic, it's mouth-to-mouth resuscitation direct, right? But with the onset of the pandemic, the American Heart Society do not recommend direct mouth-to-mouth resuscitation anymore. So there should be a barrier device, alright? So there's this barrier device that looks just like this one. This one, it's just really this one that you place it in the patient's here, then you blow on it. So it's just like mouth-to-mouth resuscitation, but there's a barrier device. But for the purposes of our demonstration, so we have this. This is a okay, the resuscitator bag or a BMV, bag mask valve. Okay, bag mask valve. A bag is a brand name. So bag mask valve.
Bag mask.
So this, I cannot demonstrate it properly because ever since we had our BLS, this is busted. So it would be nice if I can show you if there's really a chest rise because there's a proper way of doing this. Alright? So, but this will not work. I'm not sure. This is also for newborns. This is not for a child, right? Because this is too small for the patient. So, anyway, I'll just teach you how to use this. So, you have the C and E hold. Alright? So, C for here, then E. So, your middle finger will be placed on the chest. Chin. Then, angle of the mandible. Then, in the here. Right? Then the C hold would be here. Okay, so again, ideal. This is not ideal because this is for newborn. By the way, before you provide what do you call this? Before you provide rescue breaths, what should be those maneuvers that you are going to do to open up the airway? Okay, until chin lift. Okay, so head, chin, then you lift. Okay. So that your goal would be to achieve a sniffing position, alright? Not a flex position, not a hyperextended position, but just a neutral sniffing position, alright? But what about you are considering neck injury, cervical injury? Are you going to do head tilt chin lift? What's the alternative? Jaw thrust maneuver, alright? Are you BLS certified? You are? Ah, okay. So you do jaw thrust maneuver, okay? But usually in the hospital, we don't do it like that. So it's automatic for us. When we apply this one, so we do head tilt chin lift right away, alright? Then you bag, okay? You bag. But again, I cannot show you if there's chest stretch. This is not working. Alright? So where are we now? Ah, yeah. So first cycle of CPR, alright? So 28, 29, 13. Then since you are a single rescuer, then you also be the one to provide the rescue breaths. So 1, 2, alright? Then continue. Until you will reach the 5th cycle, and then that will be the time that you are going to check again the breathing and the pulse. Okay? However, take note for the single rescuer, there's a difference there. If it's a witnessed collapse, if yes, then you can still activate the emergency response system and get AED, automated external defibrillator. But if it's not a witness collapse, then you do CPR right away. Alright? So what if the automated external defibrillator will arrive? So you just attach it to the patient. So the automated external defibrillator is very user-friendly because it's made not for medical professionals, but it's made for lay persons. So there's a very clear instruction in your AED where to attach the pads. Then you turn it on, then it will say analyzing rhythm. Alright? Then it will tell you what to do. Basically, it will just tell you what to do. Then, if for example, it will discover that the rhythm is shockable, then it will tell you defibrillate. Right? Then you will defibrillate. By the way, what are the shockable rhythms? What? Okay, very good. And pulseless VT. Alright, good. So ventricular fibrillation and pulseless ventricular tachycardia. Alright, you know how it looks like?
Second one is right. First one is wrong. Ventricular fibrillation ఏ లైన్లో వస్తుంది తెలుసా నాకు తర్వాత పల్స్లెస్ ఇస్
Pulseless VTAC and ventricular fibrillation. Okay, but I think I have something like I think I have a picture here. Giving CPR is really tiring. Okay, it's really tiring. And when I was a clerk, I don't know if it will be applicable to you. It will be the first line who will give the CPR will really be the clerks. Alright? And if you are in the government hospital, usually our limit is just 5 epinephrines. Then if the patient will not be revived, then we will stop and proclaim dead. However, if you are in a private institution such as Chongwa, it will still be the family who will decide when to terminate the CPR. So the highest that we had is 20 epinephrines. So that's too much. And that's really super tiring already. Okay? I'll check where is that. There. So this is your VTAC, the one below. Okay? So you cannot appreciate P waves in your QRS complex. It's just tall, long, regular waves. Okay? Then your VFib will be here, this one. Irregular, short waves, still no P waves and QRS complex. Alright, so don't believe what you see in the movies that their flatlines, they will defibrillate. Okay, that's so wrong. Your asystole and your pulseless electrical activity PEA, they are not shockable rhythms. Okay, so you just see that on movies, but that's not true. Alright? Sige. So now let's go to that's for the single rescuer CPR. So again, I'll demonstrate, ha. So this is how you're going to do it, ha, on your what do you call this? On your third demonstration. So check the scene is safe. Let me, because the training for this is really intense. Yeah. So check the scene is safe. Hey, are you okay? Hey, are you okay? No response, so call for help, then activate emergency response system. 1, 1002, 1003, 1004, 1005. So no pulse, no breathing, start CPR. So 1, 2, 3, 4, 5, 6, 28, 29, 30. And then, provided that you have this. So 1, 2, then continue. So second cycle. 2, 3, 4, 5, 6, 28, 29, 30. And then give another 2 rescue breaths. Then it is the fifth cycle. So 28, 29, 30. So 1, 2. Then that's the time that you will check for the breathing and pulse again until help arrives. But if the rescuer becomes exhausted, that's one indication to stop CPR. Alright? Questions? So far? What else did you miss? Okay, let's go now to the left and right side of the algorithm. So what if when you check for the breathing and pulse, there is pulse and there is breathing? So you just monitor the patient until help arrives. Alright? What if, this is very common for drowning patients, what if there is a pulse but there's no breathing? What are you going to do? So you give rescue breaths. You give rescue breaths, 1 breath within 2 to 3 seconds, or 20 to 30 breaths in a minute. So still the same. So 1. Okay? For 2 minutes. After 2 minutes, you will check for the breathing and pulse again. So still with pulse but no breathing. So give another rescue breath for 2 minutes. What if when I check after 2 minutes there will be no pulse? Where will you go? Start CPR. Alright? Okay, so that will be your return demonstration. Okay, the preceptor will give you scenarios and what to do. Okay? Clear? Questions? Now let's go to your 2 rescuer CPR. So still the same. So verify scene safety. Then, hey, are you okay? Hey, are you okay? But this time, no response. The one rescuer will get the AED right away and activate emergency response system. Then the other rescuer will remain with the patient and start CPR. Alright? So, start CPR. So for example, first cycle. So 1, 2, 3, 4, 5, 8, 29, 30. Then, what if the other rescuer will arrive? So the ratio will change now. So what's the ratio for?
2:50.
It will be 15:2. So it's not as tiring as the single rescuer CPR. Alright, so 1, 2, 3, 4, 13, 14, 15. But this time, you won't be shifting positions. Alright? Because the other rescuer will be the one who will be in the head and giving the rescue breath while you will remain here. Alright? But you will switch after 5 cycles. Okay? You won't be switching every other cycle of CPR because again, what's the fourth component of a high quality CPR? Minimizing interruptions because you're trying to save a life. So you just switch after 5 cycles. Alright? Clear? Alright. So that's it. You want to practice? Or you have questions? Questions? You can practice.
Just in case of when you don't have the bag, what can you do?
If you don't have the bag, there is this, during the advent of the pandemic, there is this what they call hands-only CPR. So you just compress, especially if you do not know the patient or the one in the street. So just read about hands-only CPR, okay? That's one thing that they have taught in the advent of the pandemic. It's just basically you're just doing chest compression. You don't ventilate the patient anymore. Alright? That's hands-only CPR. But if you know the patient and then, especially, we don't bring this every day with us. So if you know the patient, for example, a family member, then you don't have a choice, right? You should do mouth-to-mouth resuscitation. So how do you do mouth-to-mouth resuscitation? So I'm not gonna demonstrate it. So again, head tilt, chin lift. Head tilt, chin lift. Cover the nose. Open the mouth. Then you should be covering the entire mouth with your own mouth. Okay? Then give one rescue breath for 1 second only, not 2 seconds because you will be over-ventilating. Okay? So it's like breathe for 1 second. Alright? Because you will be over-ventilating then. Another one. Alright? Clear? Sige. So you want to practice? Sige, one volunteer babe. Single rescuer CPR.